Greetings guys, and welcome to today's discussion in medicine. Yes, so today we're going to talk about diabetes mellitus. Yes, so diabetes mellitus, that's the topic that we're going to discuss on this afternoon. Yes, so this afternoon we're going to discuss on diabetes mellitus. Yes, so as usual, before we start the discussion, we have to set objectives. Yes, we have to set objectives. So what are the objectives for our day's discussion? By the end of this discussion, each one of us must know the definition of diabetes mellitus. Yes, we have to know the definition of DM. Then from there, we have to know the classifications of diabetes mellitus. Of course, there are two classifications and we have to know them. Yes. After knowing the classifications of diabetes mellitus, we then have to move to talk about what? Some predisposing factors of diabetes mellitus type 2. Yes, we have to know the predisposing factors of that. Then finally, we have to end on the treatment and also the complications that may arise following diabetes mellitus. These are the objectives for today's discussion. Yes. So now, how do we define diabetes mellitus? How do we define diabetes mellitus? So in my definition, I'm saying diabetes mellitus, basically this is just a chronic metabolic disorder that is associated with a disturbance in the metabolism of carbohydrates, fats, and also proteins due to defects in insulin secretion and also insulin action. That is the definition of diabetes mellitus. So the major important things to note there in our definition is that in diabetes mellitus, there is a disturbance in the metabolism of three nutrients, of which I mentioned to say there is a disturbance in the metabolism of carbohydrates, proteins, and also fats. I also mentioned to say diabetes mellitus, it basically comes in as a result of a defect in insulin secretion or insulin action. That is the definition of diabetes mellitus. That is the definition of diabetes mellitus. So the sugar levels, they're basically regulated by two hormones. What are those hormones? We have glucagon and also insulin. These are the two hormones that regulate our sugar levels. So any defects in the production of these two hormones that I've just mentioned, it may lead to a condition known as diabetes mellitus. Yes. So these two hormones that I've just mentioned, they are produced by cells that are found where? In the islets of Langerhans. Yes. These cells that I've just mentioned, they are produced, or rather these hormones that I've just mentioned, they are produced by cells that are found where? In the islets of Langerhans, which is found in the pancreas. Yes. The islet of Langerhans have got 4 different cells. We have the beta cells, we have the alpha cells, we have the delta cells, and also have the P cells. These are the 4 cells that are found in the islet of Langerhans. So amongst these 2 cells, the alpha cells and the beta cells, they are the ones that plays an important role in the regulation of blood sugars. Insulin, it is produced by beta cells. Yes. Insulin is produced by the beta cells. Glucagon It is produced by what? By the alpha cells. Yes. So insulin, the main purpose of insulin, it is to reduce the sugar levels in what? In the blood. On the other hand, glucagon works by increasing the sugar levels. So the sugar levels in blood, they are maintained by these two hormones that I've just mentioned. Yes. So let's talk about the classification of diabetes mellitus. So just like I mentioned, there are two classifications of diabetes mellitus. We have the first classification, which is what? Type 1 diabetes mellitus. Yes. So this one, it is at times known as what? Juvenile onset diabetes mellitus. Or we could also call it insulin dependent diabetes mellitus. Why do we call it insulin dependent diabetes mellitus? In type 1 diabetes, there is lack of what? Insulin secretion by the beta cells. It is either the beta cells, they are secreting insulin in low amount, or there is total lack of what? Insulin secretion. That is in what? In type 1 diabetes mellitus. Yes. So meaning that once there is low or no insulin production by the beta cells, it means that the what's this glucose in blood, it won't be transported to the what? To the body tissues. Yes. Hence leading to a state of what? Hyperglycemia. Because the sugar levels in blood, they have become massive. They have increased because insulin is what? Is insufficient, or there is nothing at all. That is in type 1 diabetes mellitus. So diabetes mellitus type 1, it has no tendency of running in families. It is rarely inherited. The major cause of type 1 diabetes mellitus, mainly it is due to what? Autoimmune reactions. Yes. Like autoimmune of the beta cells. The beta cells become affected. The beta cells, they stop producing what? Insulin. Yes. So once the beta cells stop producing insulin, it basically means to say those glucose in blood won't be transported to the what? To the cells. Yes. So the treatment of type 1 diabetes mellitus, it is mainly through insulin. Yes. These guys, they depend on insulin doses for the treatment. That is the only treatment for these guys. Because the pancreas, the isolate of Langerhans, specifically the beta cells, they are not producing insulin. So meaning that this patient would need what? The dose of insulin for the sugar levels to be maintained. Yes. There must be an artificial, insulin that this patient has to receive in order to maintain the sugar what? The sugar levels in blood. That is for type 1 diabetes mellitus. Then when it comes to type 2 diabetes mellitus, type 2 diabetes mellitus, this one basically it comes in as a result of what? Poor insulin action. Yes. The beta cells, they are producing insulin, but that insulin that is being produced, it is not effective for that glucose to enter the what? The cells. Yes, that could be maybe those cells have become resistant to that insulin. Insulin in blood is enough, but the cells have become resistant to insulin. They are not opening up for glucose to enter those cells. That is under what? Type 2 diabetes mellitus. which is also sometimes known as what? Non-insulin dependent diabetes mellitus. Or at times we can also call it what? Mature onset diabetes mellitus. Yes. So type 2 diabetes mellitus, it does not depend on what? On insulin. Because the beta cells, they are able to produce insulin. So meaning that the best treatment for type 2 diabetes mellitus, it is through what? That is through hypoglycemic agents. We have to give hypoglycemic agents. An example of a hypoglycemic agent, it is metformin. Yes, we can give metformin. That will help in reducing what? The sugar levels in blood. We can also give glibenclamide. That is also another form of what? Hypoglycemic agent. Yes. So for type 2, it also has a tendency of running in families, meaning that this one can easily be what? Be inherited. Yes. On the predisposing factors of this one, we could talk about obesity. Yes, being obese is one of the predisposing factors to type 2 diabetes mellitus. Use of corticosteroid medications such as hydrocortisone, those may also cause type 2 diabetes mellitus. Genetic, just like I mentioned, this condition, it also runs in what? In families. Specifically type 2 diabetes mellitus, it has a tendency of running in families. We could also talk about chronic pancreatitis. Yes, chronic inflammation of the pancreas. This could also lead to what? Diabetes mellitus. Yes. So that is that on the classifications. How about the investigations? What things can we do in order to come up with what? A diagnosis of DM. Yes, history taking is very important in almost all the conditions. Physical examination, very vital. We also have to do fasting blood sugar. Yes, we have to do that. Also, random blood sugar, it also has to be what? To be done. Of which these two are the major investigations that we need to do in a patient. In what? In a patient with diabetes mellitus. Yes. So now, what are some of the clinical features that a patient with diabetes mellitus is likely to present with? There is the first one, which is what? Polydipsia. Yes, excessive thirst. Muntu wa diabetes mellitus amankana vija kumwa manzi kambiri che. Yes, that is polydipsia. The second one could also talk about what? Polyphagia. Yes. Excessive eating. What DM bamadia like no man's business. That is polyphagia. Yes. Other than that, we could also talk about what? Polyuria. There is excessive increase of what? Urination. Yes, that is polyphagia. Well, polyuria rather. Yes. Then, the other one, we also have what? Glucosuriia. That is what? Glucose in urine. Yes. So these are the four major signs of diabetes what? Mellitus. I've mentioned to say there is what? Polyuria, polyphagia, polydipsia, and also glucosuriia. So we cannot talk about diabetes mellitus without mentioning these four signs that I've just these four clinical features that I've just mentioned. Yes. On the complications, we could talk about DKA, diabetes ketoacidosis. That is the major complication of what? Of DM. We could also talk about peripheral neuropathy, retinopathy, kidney failure. All these are complications that may come in following what? Following diabetes what? Mellitus. Yes. Okay, so that's that on diabetes mellitus.